Welcome. My name is Amanda Falk. I am a partner and the Chief Clinical Officer at The Dorm, which is an IOP and PHP treatment community for young adults with locations in both New York City and Washington, D.C. At The Dorm, we often work with clients struggling with profound loneliness and isolation and the resulting symptoms associated with loneliness and isolation, such as anxiety, depression, substance use, and self-harm, to name a few. They are certainly not alone. Last year, the US Surgeon General and the World Health Organization issued warnings about the epidemic of loneliness and declared it a global public health concern. Today, we're continuing to see ongoing coverage about this epidemic. Even just last week, many of you may have seen that the New York Times Magazine published an article exploring why this loneliness epidemic is so hard to cure. At The Dorm, our model is centered around community and helping clients to really locate a supportive network to sustain long-term recovery and to find meaning and purpose in their lives. Our inaugural outcomes report has uncovered a direct correlation between measures that look at connection, friendship, relationship building, and improvements in mental health symptoms. And what we found is that by focusing on and improving social connection, relationship building, friendships, upon discharge, we are seeing a decrease in symptoms of anxiety and depression by as much as 35%. Decrease in symptoms of trauma by as much as 35%, and improvement in overall well-being scores and feelings of enjoying and engaging with life by as much as 138%. As we reflect on how our community works with this ongoing epidemic, we're really grateful to open up the conversation and learn from new perspectives with the team at the Austen Riggs Center, who have been focusing specifically on the loneliness epidemic and will be able to speak to how they see it impacting young adults today. And joining us for our presentation today is Dr. Katie Lewis, who is the Director of Research and Medical Staff Member at the Austen Riggs Center. Her research focuses on examining personality processes in adults diagnosed with complex psychopathology as they relate to suicidal and self-destructive behaviors. Her research has been supported by the Robert Wallerstein Fellowship in Psychoanalytic Research, a Young Investigator grant through the American Foundation for Suicide Prevention, an exploratory developmental research grant through the NIMH, and the APF Division 39 Marcia McCrary Grant for Psychoanalytic Research. She has published and presented on a wide range of topics, including suicide and self-harming behaviors, personality psychopathology and assessment, and the ethics of confidentiality in clinical writing. Dr. Lewis is a licensed clinical psychologist in New York and Massachusetts and operates a small private psychotherapy practice in addition to her work at Austen Riggs. We're so grateful to have her with us today to kick off our two-part event, which will begin with exploring adult loneliness through the lens of attachment and social connectedness. And without further ado, I am going to turn the presentation over to Dr. Katie Lewis.
Amanda, thank you so much. I'm so pleased to be here today. I'm just going to share my slides and get this started. Okay. It's such an honor to be here today. I really appreciate this opportunity to partner with the Dorm for this presentation. As Amanda had said, loneliness has been a topic we've really focused on extensively at Austen Riggs, and I know the Dorm has as well. And I'm sure everyone in attendance today who's working with patients or even just interacting with young people in their lives are recognizing that loneliness is a really serious issue affecting many people today. So as Amanda said, today I'm going to be discussing loneliness. I'm going to be really taking sort of an overview perspective on the topic and summarizing what's sort of understood about loneliness in the field of mental health so far. And then next week, my colleagues, Dr. Seth Pittman and Dr. Erin Seary, are going to go into greater detail about how experiences of loneliness can be recognized and addressed within the context of clinical treatment. That should be a really valuable discussion. They're phenomenal clinicians. They're wonderful presenters. So I hope you'll be able to join us both for today and for the presentation next week. It should really be wonderful. So today I'm going to be I'll mainly be taking sort of a wide overview of the topic of loneliness, but during my talk, I will be sharing a few findings from my own research program at Austen Riggs. So before getting into that, I just want to briefly acknowledge both the individuals and institutions that have supported my work over the past few years. I want to thank my colleague, Dr. Jane Tillman at Austen Riggs, as well as Dr. Michael Roche, who's an assistant professor at Westchester University in Pennsylvania. They've each been wonderful collaborators and partners on the projects I'll be describing and sharing today. I also want to thank Fiona Brown, who is currently working as a therapist at a group practice in Massachusetts, but she did extensive support for the research studies I'll be describing when she worked at Riggs as a research assistant during her training. And just briefly, lastly, I want to gratefully acknowledge the funding support provided by Division 39 of the American Psychological Association through the Marcia McCary Fund. Oops. Okay, so loneliness has been considered a global public health issue for many years now. I think it was in 2018 that the UK actually developed a Ministry of Loneliness to combat social isolation in the UK. But in the US, it didn't really emerge as a topic of major public discourse until the COVID-19 pandemic. At that time, major psychiatry journals like The Lancet began publishing position papers, which discussed both the immediate and the potential longer-term emotional health effects that might emerge in response to this global health threat. In particular, while social distancing was recognized really early on as an essential public health intervention, concerns were also raised almost immediately about what this tremendous loss of regular social contact could do to people. Emily Holmes, who's a clinical professor at Uppsala University in Sweden, published recommendations in The Lancet for research priorities, just briefly quoted here on the slide, which included an emphasis on addressing loneliness and social isolation. And she summarized the long history of evidence that experiences of loneliness are related to depression, to suicide and self-harm, and to several other mental health outcomes. Past research has actually shown for decades now that people who have strong positive connections with others actually do show better health functioning across both emotional and physical health domains. It's actually pretty staggering. So here I'm sharing a chart from an article that was published in American Psychologist in 2017 by Julianne Holt-Lunstad, who's one of the leading experts on social connection in the US. So Holt-Lunstad and her colleagues compared overall longevity rates or survival rates based on positive social connection to other factors that we know are related to health. So things like smoking cessation, abstinence from alcohol, higher physical activity, lower BMI, lower exposure to pollution, etc. As you can see from this chart, interestingly, social connection was the strongest predictor of longevity compared to all the other health factors that they examined. Also, interestingly, in most cases of the literature that they reviewed for this article, measures of the quality of social connections, rather than more objective metrics like frequency of social connection or whether one lives alone or with others, seem to be most predictive of long-term health outcomes. Excuse me. In the article, Julianne Holt-Lunstad observed that across over 300,000 individuals who were followed for an average of 7.5 years, having adequate social relationships was related to a 50% greater likelihood of survival compared to those with poor or insufficient social relationships. So this really puts positive social connections on par with the beneficial health effects of things like quitting smoking, and really puts it beyond other potential benefits of other factors like healthy BMI and greater physical activity. Sorry, take a sip of water. So over the past decade or so, social connection has been defined using 3 dimensions, and those are represented in this chart here. So the structural dimensions of social connection, which is represented in this yellow box, refer to the general size and accessibility of someone's social network. So how many individuals does a person interact with on a day-to-day basis? How many people live in their household? Does an individual work alone, remotely, or are they in an office or a school surrounded by others? A second dimension in the green box relates to the functional aspects of social connection. So this addresses things like, does the individual feel a sense of belonging or inclusion within the social network that they have access to? Do these social connections serve to keep feelings of things like loneliness and isolation at bay? is there a sense of adequate social support, whether the social support is emotional or more practical. Finally, on a more individual level, in the blue box, we have the qualitative aspects of social connection. So this refers to things like the more intimate aspects of our relationships. Do we feel a sense of love, of care, meaning, joy, or comfort from our connections with family and friends or other loved ones? So an individual's degree of social connection can vary along these three dimensions. They don't necessarily always go together. Someone can live in a rural area and be relatively isolated, but find a high sense of meaning, love, and connection in the few relationships that they have with immediate family members, as an example. Loneliness is classified by most scholars in this area as falling into the functional domain of social connectedness, and that it really emphasizes the sense of inclusion and support. So someone can have a low frequency of social contact and not feel lonely if they also feel like they do have a sense of belonging in some part of their life with some social group in their life. Loneliness is a relatively common emotional experience. I think we all sort of understand that. You could really argue it's a normal part of human experience. For most people, though, loneliness represents a temporary or a transient state, something that sort of ebbs and flows and tends not to last very long. However, despite this, a recent study did find that for up to 30% of Americans, loneliness can reach more chronic levels. I'm going to come back to a lot of these statistics or ideas in a moment, but just by way of brief overview, feelings of loneliness have been found to be more prevalent in people who are younger than age 18, and also people who are older, those over 65. And in its more chronic form, when it sort of persists over time, loneliness is associated with a really wide array of negative health outcomes. I'm sort of jumping back a little bit at this point. We're talking about loneliness, but I think it's important to define it. It's been defined in many different ways. Most definitions from the scientific literature really emphasize how it's differentiated from these more objective indicators of social connection. So things like the structural aspects like frequency of social contact. Definitions really underscore that it's a subjective feeling state that relates to feeling that one's emotional needs are not really being met in current relationships. So I like the definition that I provided on this slide, which is offered by two researchers named Louise Hockley and John Cacioppo. These are two researchers who have published some of the most insightful and influential studies and overviews on the topic of loneliness. And they describe loneliness as a distressing feeling that accompanies the perception that one's social needs are not being met by the quantity or especially the quality of one's social relationships. So while loneliness is a universal experience, it's observed across cultures, it's observed in primates. In some recent historical reviews, it's also been framed primarily as an ailment that really reflects modern cultural values. The New York Times Magazine article that Amanda mentioned, I think, gets at this a little bit. There's been some other recent articles sort of saying that loneliness is really something that represents an issue of disconnect in our modern culture. Faye Alberti is an author who recently wrote a book called A Biography of Loneliness. And she states that the experience of loneliness was rarely a point of focus or concern when communities were bound more around shared labor or around agricultural concerns. This time period is really contrasted to our modern era when people are more independent and also when people have greater access to information that allows for social comparisons. So Hockley and Cacioppo really argue that human beings are most likely to feel disconnected when they recognize that their efforts to harness the power of social connectedness are unsuccessful. So when you try but fail to establish a sense of closeness with others, and this is something that you sort of carry an awareness of throughout your daily life. Whatever the broader scientific history, I just want to pause and sort of observe that loneliness has been a focus of culture and the humanities and the arts for centuries. On this slide, I thought it would be relevant to share just a few examples of how it's been written about over the past few centuries. I'll try to speak slowly so people can kind of read through these great excerpts. But here I'm sharing sort of quotes from everyone from Sylvia Plath, who describes feeling isolated in the midst of seemingly joyful activities in daily life, to Shakespeare and King Lear, who describes the power of companionship as a way of quelling feelings of suffering and grief, to a modern poet named Fanny Howe, who links loneliness with shame and feelings of almost taking up too much space. So I think as we read these excerpts and sort of think about other other sources of literature or art that we can think of that address loneliness, we can all kind of feel our way into this experience, which carries with it different elements, all of which are really salient and powerful. There's a sense of quietness, of pain, of longing, a kind of disconnect from joy that in many ways can feel unbearable, especially if it feels like it's persisting interminably. So I want to contrast these really evocative literary excerpts with a look at how experiences of loneliness have been defined and measured from a scientific perspective today. So loneliness has primarily been studied using self-report measures like questionnaires, where individuals are asked to evaluate their own perceived level of loneliness using items like those listed on the left-hand side. So those are items taken from the UCLA Loneliness Scale, which is one of, if not the most widely used measure of loneliness used in empirical research today. As you can see, the items on the UCLA measure don't explicitly use the word loneliness, but they do address feelings of isolation, disconnection, and feeling a lack of support or understanding from others. Measures that are used to evaluate loneliness in children and adolescents, which I have the major ones listed on the right-hand side, usually explicitly reference connections to friends and classmates in school settings. So there's sort of an acknowledgement around the sort of pressure around peer relationships that's much more salient during that developmental stage. Now, just as a side note, a sort of subspecialty or interest of mine is in personality assessment, and I'm usually a huge proponent of trying to use multi-method approaches. I usually don't like just relying on self-report. I think it's often hard for people to capture through self-report measures what their experiences or what their behaviors are like on a day-to-day basis. But I think in the case of loneliness, given that it's such a deeply rooted subjective experience, that actually using questionnaires isn't necessarily a bad approach. I think loneliness is something that isn't really amenable to observer or informant ratings. You really do need to hear from the person what their experience is like. And so any of these measures make a great deal of sense to use if you're interested in trying to understand something about a person's level of loneliness. That being said, there are some limitations with these measures. For example, most haven't been developed or evaluated in diverse or potentially high-risk groups. So for example, those with greater racial or ethnic heterogeneity, or those with greater neurodiversity. And in the case of the child scales, even though they've been used in studies with children as young as age 5, the measures weren't necessarily normed for younger age groups, and there might be important differences in how loneliness is defined and experienced by children during these particularly early developmental periods. And just again, as a quick aside, of course, because I had this talk scheduled this week, earlier this week, my 5-year-old daughter had a comment about loneliness that I thought I would share. She was in timeout. We were sort of having a showdown over dinner, and she mentioned to a family member of mine that being in timeout away from her family was more terrible than her idea of what being eaten by a shark might feel like. So I think in that case, it's pretty evocative and interesting to hear from a 5-year-old's perspective, just what it feels like to feel outside of the group that you feel a sense of belonging into. Obviously, I'll never put her in timeout again, but just thought I would share that. Okay, so as with most things in mental health research, taking a multi-method assessment approach does make sense. So for those of you that do clinical assessment or personality assessments, I think administering one of these questionnaires along with something like a sentence completion task or a picture story task, or even just a really in-depth clinical interview that allows a person to share more qualitative information about what their feelings of loneliness and disconnection feel like is a very helpful approach and can really help to inform treatment planning and case formulation over time. In our research program at Riggs, we've often used a single item, which is listed here in the bottom right, that we administer to participants in our study via smartphone several times a day over usually a 2-week period. And we use this item to track how feelings of loneliness change over time and across different contexts. So while in the previous 2 slides, I think the main point I want to make with this discussion about measures is that we've seen sort of the scientific definition of loneliness and also how it's been represented in this really powerful way through the humanities. But when we think about the empirical base of our knowledge of loneliness, the actual specific items in these measures that individuals are responding to that have helped us build a basic foundation to our empirical literature on loneliness is slightly different. It's a little bit more of a scaled down concept, sometimes misses the perspective of the individuals that are being studied. Although I think overall it does still get at the basic elements of what we think of when we think of loneliness. Okay, so returning to loneliness and sort of a lifespan perspective, as I'd mentioned before in epidemiological studies, loneliness tends to show peaks in early adulthood and then again in later adulthood in older adults. So the graph shown here is from a study by Louise Hockley and colleagues, who I mentioned before. They collected data from around 2,500 individuals ranging in age from 18 to 89 living in the US. What they found was that while age did predict loneliness around these peaks, um, th they actually found that these associations were almost fully accounted for by other factors. So once you controlled for things like social contact frequency, household income, and physical health, the associations between age and loneliness disappeared. So really what this means is that age isn't driving loneliness per se, but rather the social and health factors that change and fluctuate naturally over the course of a lifespan really influences vulnerability to loneliness at different stages of life. That being said, experiences of loneliness in emerging adulthood or in this young adult age period versus later adulthood carry very different implications. So, an earlier study by Hockley, for example, found that high feelings of loneliness in individuals in their mid-20s, which persisted over time, which turned into chronic states of loneliness, were related to greater risk of mortality from cardiovascular illness. So chronic loneliness really does affect physical health in a way that can influence individuals throughout their lifespan and can actually shorten the lifespan over time through this indirect path through physical health. So, we should really take loneliness in this early adulthood stage very seriously in terms of longer term physical health effects. So in addition to predicting mortality and morbidity, there have been various studies of loneliness in adults that show associations with other factors. I won't spend a terribly long amount of time on this, but loneliness in adulthood has been associated with impaired cognitive functioning, poor self-regulation capacities, higher rates of mental health issues, decreases in health promoting habits and behaviors like physical activity, issues with sleep impairment and immune functioning. There's an interesting study that looked at rates of loneliness in a cohort of 12-year-olds and found that higher loneliness at age 12 actually predicted lower employability and lower economic status at age 18. So, there's some economic costs that are really interesting right at this adolescent into early adulthood phase when people are really launching into their early adult life. And then research by our lab and other labs have really shown a strong connection between higher loneliness and suicide risk. So stepping back for just a moment from the topic of loneliness, I want to shift gears to talk about social connection and attachment. Now, we typically think of greater social connectedness as being more adaptive. So most of us probably think of ourselves as wanting to have larger networks of loving and devoted friends and family. But of course, people vary really widely in their level of comfort or desire for closeness, depending on things like their personality and their history of experiences in relationships. So, what they've come to learn or expect from relationships. So, I think that this is where the framework of attachment theory really becomes relevant to our discussions of loneliness and social connection. As many of you might be aware, if you've had some exposure to attachment theory before, attachment theory argues that emotional bonds with caregivers during this really early period in life interacts with infant temperament to influence the development of emotion regulation capacities, personality traits, and social behaviors throughout the lifespan. So childhood experiences with caregivers who are inconsistently available or who are in other ways somehow problematically engaged with the child may lead to the development of insecure attachment. Insecure attachment can manifest either through an over-reliance on relationships. We might call this anxious attachment, sort of a hyperactivation of the attachment system where you're constantly scanning, trying to make sure that others are there if you need them. It can also manifest through a disinterest or disavowal of emotional intimacy, which is sort of a underactivation of the attachment system. And we call this avoidant attachment. So like loneliness, both anxious and avoidant attachment emerge in the context of problems with emotional needs being met in relationships. An interesting thing about the attachment system is that it's really viewed as something that's activated under conditions of stress. And so when you're going to the grocery store, in theory, your attachment system should be pretty quiet. There shouldn't be a lot of hyper focus on relationships or the availability of others. But in traumatic life situations, so things like unexpected loss, any sort of threat to life, things like a global pandemic, the attachment system is activated, and the importance of relationships becomes much more salient as you go about your day-to-day activities in life. So we did look because of this interest in how the attachment system was activated during the pandemic. We did run studies at Austen Riggs during the first year to year and a half of the pandemic. And we found that attachment insecurity, both anxious and avoidant attachment, was related to greater rates of loneliness during this early stage. In particular, we also found that insecure attachment styles predicted suicide risk during the pandemic, although in different ways. People with anxious attachment were more vulnerable to suicidality, sort of overall, regardless of how frequent their social contact was or how accessible others were to them on a day-to-day basis. Whereas interestingly, those with avoidant attachment were more vulnerable to having suicidal thoughts on days when other people weren't as available. So you might expect the opposite. It was sort of interesting that people who didn't rely as much on relationships were more distressed on days when they couldn't see people. But those are some of the findings we found that could inform future interventions for supporting people with those vulnerabilities during times of stress. Interestingly, there's a researcher named Peter Helm, who's a member of the psychology faculty at Montana State University, who studied something called existential isolation in people with different attachment styles. Dr. Helm has found that individuals who are anxiously attached report higher feelings of loneliness, as we've been talking about it and defining it so far, meaning sort of a lack of sense of belonging to a group, longing for a greater sense of connection with others. But people with avoidant attachment styles instead report higher rates of this deeper sense of experiential disconnect from others, this existential isolation. So it's not just a lack of belonging, but a real sense that their entire experience of being is totally different from others, and that this represents some sort of unbridgeable gap. So I think findings like this and thinking about the different meaning of relationships to people based on their experiences in early relationships really represent a good reason why, again, in the context of clinical assessment or treatment, allowing individuals the opportunity to describe their feelings of loneliness or what loneliness means to them using their own words is really invaluable. So across these and other studies, we can see that attachment styles or attitudes have a strong effect on vulnerability to loneliness. If a person is raised to have low expectations for the degree to which others can provide emotional support or safety, then vulnerability to feeling alone, even if others are present or accessible, is elevated. So far we've reviewed the broad literature on loneliness. We've talked about the role of development, mainly in the context of these attachment experiences and attitudes. But I know that specifically for today, we really want to zero in on the experiences of young adults or emerging adults. So those falling in this really complicated life stage that occurs roughly between the ages of 18 to 30 or early 30s. So this period of emerging adulthood was really first explored as a developmental stage by Jeffrey Arnett in an article that was in the American Psychologist in the early 2000s. This developmental period carries a number of milestones, just some of which are listed here. So usually people in this age range are ending formal education and entering the workforce on a full-time basis for the first time. They're experiencing more mature romantic relationships, and for some people, they're entering marriage. Some people are beginning parenthood. They're entering into the stage of parenthood. Almost everyone is experiencing an increase in responsibilities and independence, particularly financial independence. And through these peer relationships and changing context of family relationships, people are really refining their worldviews and developing a sense of identity. In cognitive research, I find this so fascinating. It's been found that in later life, most people identify their most important lifetime memories as occurring during this stage. It's something called the reminiscence bump. So people in their 60s, 70s, 80s, if they're asked spontaneously to describe their most important life memories, they tend to fall during this really important developmental stage. For the most part, people who enter this stage of development with secure attachment styles tend to remain secure, and they tend to be able to weather these transitions relatively well. There are findings from a few studies that suggest that major upsets, like a traumatic loss of a relationship, or particular distress around career challenges or launching into professional life, can influence the new development of insecure traits. So for people who were previously securely attached, there's sort of an experience of shaking of faith in others or in the world that can happen under particularly traumatic circumstances. Otherwise, feelings of attachment security tend to help people and fortify people to navigate these different milestones and life transitions. Feelings of chronic loneliness can influence how people navigate the challenges associated with this period. So in experimental studies where experiences of loneliness were hypnotically induced, loneliness not only increased depressive symptoms, but it also increased perceived stress intensity, fear of negative evaluation, feelings of anxiety and anger, and it diminished feelings of optimism and self-esteem. The authors of that study argued that loneliness affects what they call the scaffolding of the self. So in connection with emerging adulthood, this very core process of building a self, of sort of becoming who we are and who we will be throughout most of our adult life, can really be negatively impacted by experiences of loneliness. Loneliness can inflate feelings of stress and really compromise the capacities for resilience and adaptation in the face of challenges, in a way that really makes navigating the developmental demands of this period really challenging. Okay, so going back to these different forms of social connection that we started with earlier in the talk, research has shown that in early adulthood, the components of social connection that are most influential for overall health outcomes are the structural and functional aspects. So questions about how available or accessible are others? Do you have a large social circle to access or to draw from? And do the communities that you have access to offer an opportunity to feel a sense of belonging and connection? There may be conflict or drama and tension in individual relationships. These more like qualitative aspects might be a little bumpy. But overall, if the general feeling during early adulthood is that there is an emotional safety net available, a way that you feel you belong somewhere, then health-related outcomes tend to look better compared to if this basic sense of belonging is lacking. I think part of the reason for this may be related to the tasks that we just looked over of emerging adulthood, the sort of cultural expectations around goals like settling into stable romantic relationships, finding a circle of friends, establishing oneself professionally, and refining worldviews and attitudes. Each of these, in many cases, requires access to an available and welcoming social network. In middle adulthood, in contrast, the sort of later adulthood period, when most of these goals presumably have been achieved or are on their way, then the quality of relationships, this more like intimate aspect of feeling connected with others, becomes more important. And then in later adulthood, following retirement, there's a higher risk of isolation due to health or mobility issues, economic limitations, or other social factors. So we see a resurgence of the structural and functional elements, again, taking a more primary role in determining health outcomes. So for emerging adulthood specifically, many studies have shown that there are higher rates of loneliness in this age group, at least compared to middle adults. And again, from the findings we discussed earlier, there isn't really evidence to show that this is due to age alone, but rather to broader sociocultural climate and influences happening during this period, at least in our Western culture. Loneliness in this emerging adult age group is rising. It's been the focus of several media pieces, one of which was the New York Times Magazine article. Also, there was this article in The Atlantic by Faith Hill that I think really wonderfully captured some of the complicated things going on with people in their 20s. A few interesting qualitative studies have also explored how young adults think about loneliness and perceive its effect on their lives. They identify contributing factors like feeling misunderstood, feeling pressure to fit in, pressure related to life transitions, pressures related to being socially accepted, which are then amplified through things like social media. A participant in one study, I just want to share this quote because I think it's very helpful. There's a participant in a study who said, even if you bring your friends with you from high school to college, you're all going to have different schedules. You're all going to have different priorities in life. So even if you have the same group of friends, it can still be difficult to foster that connection and keep it strong. I feel like it would be susceptible to kind of like getting a little less strong over time. So I like this because I think it really gets at the heart of this difference between structural and functional aspects of connection. It's really not just about the presence of people, or even in this example, the familiarity of people, but really whether the people that are around you, if they're able to fulfill this need of feeling love and support and feeling understood. There are a few factors that are known to prevent against loneliness in the young adult age group. These include perceiving one's parents as caring and having close friends, so having a strong established social network, not leaving the parental home before age 18, which I think is sort of a proxy for representing a stable home environment. Having a greater sense of agency is also related to lower loneliness. Returning to live at home, which I think again kind of represents this difficulty with launching into adult development, was related to poor mental health in young adults, whereas social integration and romantic attachment predicted more positive health outcomes. There's also been several studies showing that exposure to discrimination or disadvantage based on aspects of one's identity can lead to reduced resilience and also increased risk of loneliness in this young adult age group. So as I'd mentioned before, we conducted some studies of loneliness during the pandemic. One of the studies we ran recruited participants between October of 2020 and January of 2021. So this is towards the end of the first year of the pandemic, right before the vaccines were being rolled out. And we asked, one of the questions we asked in our study was sort of a general adult sample recruited across the US. Was we asked people to just sort of spontaneously describe how the pandemic had impacted their lives or their plans over the past year. So these responses on the slide are responses from participants who ranged in age from 22 to 32, so sort of capturing this emerging adult age range. And just reading through them, I want you to sort of think through the tasks that we know are really salient for people during this emerging adult period. I was going to go to Australia for a graduate summer program. 2 close family members died. My very close cousin gave birth and I haven't been able to meet the baby. My sister's bachelorette and wedding were canceled and postponed. I usually take a 6-hour trip to see my family. I haven't seen them since January. I'm having increased panic and anxiety symptoms, and I miss my Dungeons and Dragons group. I put off my wedding for a year. It's impacted the birth of my daughter and her early life. So these, I think, again, really just show how this experience of disconnection impacted milestones that are really important for this group. And in particular, I love the Dungeons and Dragons reference because, again, it represents this space of belonging that might seem frivolous, but ends up being so important for warding off feelings of loneliness. I'm so glad that this participant volunteered that small detail from their life that, that stood out to them when asked to think about the most important ways that the pandemic had impacted their life. Of course, in our sample, we weren't just recruiting early adults, we recruited people across different age groups. And so I also thought it would be interesting to look at some of the quotes from those falling into their parent, the potential parent age group, and to look at comments about how parents were experiencing being separated from their children as their children entered into this next stage of development. So these quotes are from participants who ranged in age from 55 to 63. So one participant said that they missed our children, now post-college, moving on with their lives. My daughter is at college and is struggling. She constantly calls me for support and companionship because it's impossible to make friends. This is very stressful for me. She's getting weekly counseling sessions, which has helped a lot, but it doesn't change how often she calls me. I miss my family. I haven't been able to travel to see my children or grandchildren, and it's crushing me. So in particular, I feel like the middle quote from here gets at this idea of how insecure attachment can get kind of activated under these really extreme conditions of stress. We hear about this daughter who's really struggling at college and needs to sort of scan and do outreach for a sense of closeness and proximity, and is just finding it very hard to adapt or to find equilibrium. But I think across the two age groups, it just gives us this insight into how the pandemic impacted not only rates of loneliness, but just identity development and entering into this adult stage of development. Okay, so For this final part of my talk, during next week's talk, we're going to delve deeper into clinical treatment. I just want to briefly touch on some aspects of what's known in the literature that I think is relevant for treatment. So relationships, again, are an important and crucial factor influencing mental health. There are individual dispositional factors, things like cognitive flexibility, the capacity to adapt across situations, that are also important. But regarding relationships, there's been some recent research, interestingly, showing that having more close connections isn't necessarily better. This is called the diminishing returns model of social support. There was one study that found that having just a few close and supportive relationships was exponentially more beneficial for emotional health than having none at all. But it didn't necessarily reflect that having more connections was beneficial with this sort of exponential rate. So in other words, having one best friend is better than having no best friends, but having 100 best friends does not make things 100 times better. I think this is intuitive, but this study was able to sort of show that. So what does this mean for treatment or for thinking about interventions? Essentially, I think findings like this really suggest that there's tremendous benefits to be gained from helping people, from helping patients to develop a few close supportive personal bonds, even just with one or two people. So loneliness can really be mitigated dramatically simply by helping people to find those one or two very close others, to sort of borrow a term from the attachment literature, rather than sort of giving them a blanket encouragement to just go out there, get in social settings, like mingle. Sort of the broader exposure isn't necessarily going to be the thing that helps reduce those feelings of loneliness. We've discussed some of this already, but to recap, there's extensive past research showing that people who have some of these strong positive social connections show better physical health functioning across multiple domains. Moreover, the psychological benefits of positive social connection go both ways. So being the recipient of social support helps to buffer against stress, increases the capacity to cope, etc., but also providing social support and being there to offer care and kindness to others also increases a sense of belonging and can increase self-esteem and reduce stress. So Louise Hockley, who I've talked about a lot today, is primarily a researcher, but she did publish an article a few years ago analyzing different treatments for loneliness. And she really isolated 4 elements that have been integrated into various treatments for loneliness. And those are listed in the top half of this slide. She advocates, based on this research and other research on just cognitive and affective factors related to loneliness, that really treatment models should emphasize one of these elements in particular, this one in bold of maladaptive social cognition. Hockley states, our model of loneliness holds that implicit hypervigilance for social threat exerts a powerful influence, and loneliness may be diminished by reducing automatic biases from this hypervigilance that favor over-attention to negative social information in the environment. So based on the meta-analysis, Hockley and her colleagues did find higher effect sizes for treatment outcome for treatments that emphasize the social cognition as a focus of their intervention. These were significantly larger than the effect sizes for interventions that focus simply on social support, social skills, and social access. So in other words, it isn't just about increasing access to others. Lonely individuals often carry beliefs about themselves, their world, and others that increase a barrier to feeling a sense of belonging. And these attitudes and beliefs and the developmental roots that contribute to them really need to be identified and addressed in treatment in conjunction, of course, with whatever other kinds of interventions, which might be aimed at promoting social contact the therapist might decide to use. So this is another area where I think attachment theory and attachment-based interventions like mentalization-based psychotherapy can have high utility in that they really address underlying schemas and attitudes about what role relationships can and should play in emotional health, safety, and stability. Oops. So just to wrap up, looking ahead, from my perspective, I think there are 4 priorities that should be looked at in future empirical, clinical, and public policy domains as it pertains to loneliness. I think there needs to be continued studies of the biopsychosocial factors that affect loneliness, and these should be done using these multi-method approaches so we really get a sense from people of how they are experiencing loneliness, not just how they're rating themselves on loneliness using these scales. We also need to look at multi-time point designs to understand something about how loneliness fluctuates and is triggered across different circumstances. We need to do more research on these social cognitive factors that Louise Hockley had identified, understanding how they influence vulnerability to and maintenance of loneliness. And then from these findings, develop a better understanding of how to develop and evaluate the effectiveness of interventions for loneliness. And finally, I think we need to address broader cultural and societal factors that influence loneliness in different communities. And by this, I'm really thinking of upstream interventions that provide greater support to communities, families, parents, and children, given that we know that secure attachment is such a powerful buffer against a whole range of mental health issues, but in particular, feelings of loneliness. I think supporting the development of secure attachment by giving families and parents the resources they need would be a really wonderful way of addressing the loneliness epidemic in the US. So thank you for your time. I think I'll leave it there. I have my contact information here, and I'm happy to share slides and references for this talk or to answer questions, but I'm looking forward to hearing your questions. And thank you again to the dorm for having me here for this.
Thank you so much, Dr. Lewis. We have a lot of activity in the chat and in the Q&A. We also have, I see two people with raised hands. I don't, sometimes people accidentally do it, sometimes people do it on purpose. So I do want to start with giving the two people that I see that have raised their virtual hands, an opportunity to ask questions off the bat. Lisa Romero.
Hey, Lisa, you might have to unmute.
Yeah, you're. Okay, what about Rosalind Barnes? Did we mean to do a virtual hand up? Okay. All right, let me get to some of the questions that came in through the chat and the Q&As. One question that came up, actually, it came up a couple of times through various different questions. There was a question around, is there any correlation or findings related to the development of personality disorders? Somebody else also asked separately, what personality type is more likely to experience a pathological level of loneliness? So I was wondering if you could speak to like a personality aspect, whether that's a personality disorder or.
Sure. Yeah, I think so I don't have the literature off the top of my head to cite, but I do know generally the findings are that that personality disorders are associated with a greater sense of loneliness. I think for this very fundamental reason that there's just problems, they're interpersonal disorders, so there's just difficulty with finding adaptive ways to connect with people. I think also insecure attachment is overrepresented in patients with personality disorders, so it operates through that pathway as well. But I think, I think, again, this is where when you're thinking about personality disorders, it's really not just about the trouble connecting. It's also about the sort of fundamental underlying attitudes about relationships, whether it's a particular form of personality disorder where relationships are undervalued or sort of disregarded as something that's important to focus on, versus where there's sort of an over dependency or anxiety around whether others will be there and hyperactivation around it. I think that loneliness can function in different ways depending on those attitudes. So yes, it's higher, but as with anything, if you're working with a patient with a personality disorder, thinking about those dimensions and the particular ways that might influence attitudes about relationships is the first place that you start before you think about how to make inroads with reducing experiences of loneliness.
Another theme that came up across multiple questions, but I'll try to capture it in one question, pointed to the role of sort of, social media and our tech culture. As so many college students are returning this semester, does social media inflate feelings of loneliness as opposed to strengthening feelings of social connection for many young adults and college students? Finding a circle of friends might feel easier online or on social media. How does this play into the whole loneliness epidemic conversation?
Yeah, it's a fantastic question, and one I think that comes up a lot, both in the talks I give on loneliness and suicide risk. And I think the evidence overall is that greater social media use, like really high levels of social media use, are related to things like more negative affect and I think more greater feelings of loneliness. But it's not really a simple story. And I think, Amanda, for some of the things that you were hinting at in your question, that social media plays a really important role in young adult identity development and peer relationship formation. And it's not all negative. There's a researcher named Emily Weinstein who publishes qualitative studies where she interviews young adults about their social media use, and she has applied this really wonderful developmental Ericksonian frame to understanding like how people are using social media to find a sense of self, to navigate relationships. And you could imagine, in particular, for people that have more marginalized identities or are just having trouble connecting with people in their immediate social environment, that being able to access broader peer groups that reflect their values, that reflect aspects of their identity through these virtual spaces can be incredibly important and sometimes life-saving. She gives an example. This is sort of a weird example, but there was an example in one of her papers of I think, an adolescent who felt quite socially isolated and was living in an inner city setting, but had sort of a weird interest in fly fishing. And for him, connecting with a virtual fly fishing community, like, gave him sort of a sense of belonging and meaning and excitement and positive affect that was really hard for him to find elsewhere. Again, that's a sort of an odd specific example, but fly fishing, of all things, like the Dungeons and Dragons group, represents a space that's a very personal space of belonging that might be really hard to access, depending on what your immediate social environment is like. So I think that if people are using virtual connections in place of in-person connections that might otherwise be available, then you're running into some problems, and there might be some intervention to do around, again, like reducing expectations for rejection. If that's, if this sort of implicit attitude or expectations are driving barriers to connecting with people that are around you, then there's something in treatment that can be done about that. But in some cases, it also is that people just need to use virtual spaces to find their people, and that's a positive use of the medium. So, yeah, but it's a great question. I think I'd be curious what the audience has to, not necessarily today, but people have
Yeah,
thought.
there's
Yeah.
so many questions on this. We could probably do a whole presentation just on this topic alone. Can you expand on what your thoughts on ways to improve social cognition?
Yes. So my training is as a psychodynamic clinician, but I think an awful lot about the models that people build of their interpersonal world and of their sense of self. So I think, whether you're practicing more of a cognitive behavioral perspective, psychodynamic perspective, whatever your orientation, just understanding what are the rules that people have sort of arrived at through their social learning about what to expect from relationships. And then how do you help people sort of break through the rules that are no longer serving them well? So whether this be a focus on expectations for rejection or negative evaluation, just feelings of anxiety of what it means to get too close. Interestingly, a lot of the studies I do with Briggs patients, I'll do a feedback session about their research data, and I've had a few patients go through who have used these sort of smartphone ratings and describe themselves as feeling more lonely the more close they feel to people throughout the day. And they recognize that that's, it's a contradiction, but there's something about getting close to others and feeling connected that raises the stakes and makes them more aware of their anxiety around, around losing that relationship or losing that feeling or botching it in some way. And so to the extent that you can sort of have people break down specific interactions and understand these sort of quiet rules that are operating in the background that are dictating how they're interpreting social cues or what expectations they have, I think that's really where the most bang for your buck will be in addressing the social cognitive piece of loneliness. I hope that makes sense.
Thank you. I'm mindful of time. I know we have so many more questions and we still have a part 2 of this presentation. So hopefully some of those questions will get answered in part 2. I saw some questions around us sharing slides in the presentation, which will also happen following this this webinar. But we wanted to just thank you all so much for being here today. And thank you, Dr. Lewis, for joining us and for leading this important conversation. Keep your eye on your email inbox for instructions on completing the evaluation so that you can get your CE credit. And we will continue with part 2 of the event, which will focus on therapeutic solutions and community building with Dr. Seth Pittman and Dr. Erin Seary of the Austen Riggs Center Virtual IOP. So thank you all. Thank you, Dr. Lewis, and we'll see you soon.
Thanks, everyone.